Today, I have to be completely honest with you right now. I have been getting flooded, absolutely flooded, with messages and comments from seniors, from green card holders, from immigrant families who are terrified right now. People who have been living and working in this country for decades, paying taxes their entire lives, raising their families here, and they genuinely believe they have lost everything. They believe that because of all the changes happening in Washington, all the new laws, all the back and forth that has been going on throughout 2025 and into 2026, that they no longer have access to any benefits whatsoever. And I need to address this today because it is so important. Because what I am seeing breaks my heart. People who are 65, 70, 75 years old. People who worked 30 years in this country, who paid into Social Security every single paycheck for decades, and they are sitting at home right now genuinely believing that their benefits are gone or that applying for what they are owed will somehow get them in trouble. That is not okay. And that is exactly why I am here. So if you are a green card holder, if you are a lawful permanent resident, if you are a senior immigrant 60 years or older in this country, please stay right here with me through this entire video. Because today, I am going to walk you through 5 benefits that most green card holding immigrants have absolutely no idea they are entitled to, and I'm going to do it in a way that is clear, honest, and something you can actually take action on. Before I get into everything, let me do what I always do and just clarify who these videos are for, because I want every single person watching to know they are in the right place. This channel is for Social Security retirement recipients, Social Security disability recipients, SSI recipients, low-income seniors, immigrant seniors, green card holders, people receiving VA benefits, people receiving railroad retirement benefits, and anyone who is just trying to navigate the benefits system in this country and cannot figure out where to turn. That is you. You are who I show up for every single day. And I want to be your advocate. I want to be the person in your corner who actually tells you the truth about what you are entitled to, not the version of the truth that scares you into not claiming what is rightfully yours. So let us get into it right now because we have a lot to cover today. I want you to pay close attention to everything I am about to say because this is specifically updated for where things stand right now. There have been a lot of changes over the past year. The One Big Beautiful Bill Act was signed into law on July 4th of 2025, and that law did change eligibility rules for a number of immigrant categories. I am not going to pretend that did not happen, because it did. But here is what the news headlines will not tell you. And here is what the fear spreading around immigrant communities right now is completely getting wrong. Green card holders, lawful permanent residents, people holding that I-551 card, are still protected. You still have access to programs that the vast majority of you are not claiming. And that is what today is all about. Let's get into these 5 benefits right now. Benefit number 1. Your Social Security retirement benefits. And yes, you earned every single penny of them. I need to start here, because this is the one that confuses people the most. And it is also the one that angers me the most when people do not claim it. If you are a green card holder who worked in the United States and paid Social Security taxes on your income, you have been accumulating work credits this entire time. In 2026, you earn 1 Social Security work credit for every $1,810 in covered wages or self-employment income, and you can earn up to 4 credits per year. To qualify for Social Security retirement benefits, you need 40 credits total, which works out to roughly 10 years of work in the United States. And here is the thing I really need you to hear. Those credits never expire. They do not disappear if you took time off. They do not go away if you traveled back to your home country for a period. If you worked here, paid taxes here, those credits are sitting on your Social Security record right now waiting for you. The eligibility rules for Social Security retirement are identical for lawful permanent residents and for United States citizens. That is not a suggestion. That is the law. Now here is something else that a lot of people in the green card community do not realize. You do not have to wait until you are 67 to start collecting. You can begin claiming your Social Security retirement benefits as early as age 62, though your benefit amount will be reduced if you take it early. Full retirement age for anyone born in 1960 or later is 67. And if you wait until age 70, your monthly benefit is actually higher than it would be at full retirement age. But the key thing is you have options, and you need to know those options exist. If you are unsure whether you have enough credits, you can go to ssa.gov and create a My Social Security account for free. It will show you exactly how many credits you have accumulated and give you an estimate of your monthly benefit amount. Please do that today if you have not already done it. It takes about 10 minutes, and the information you find there could genuinely change your financial situation. Benefit number 2, Medicare, the health coverage. That green card holders are not signing up for this one is enormous, and this is one where I genuinely see so many people leaving money on the table, or more accurately, leaving health coverage on the table when they desperately need it. Here is the situation as it stands right now in July 2026. Green card holders remain fully eligible for Medicare. The One Big Beautiful Bill Act that was signed last year did restrict Medicare eligibility for certain other immigrant categories, but lawful permanent residents are explicitly protected. Green card holders are among the only 3 groups of lawfully present non-citizens that retained full Medicare eligibility under that new law. So, if you have been scared into thinking your Medicare is gone or that you cannot apply, please set that fear aside right now. Now let me walk you through exactly how this works. To qualify for Medicare as a green card holder, you generally need to be 65 years of age or older, and you need to have been a lawful permanent resident for at least 5 consecutive years. If you or your spouse worked in the United States for at least 10 years, meaning you accumulated those 40 work quarters, you qualify for premium-free Medicare Part A, which is hospital insurance. That means no monthly premium for your hospital coverage. If you have not worked those full 10 years, you can still get Medicare Part A, but you will pay a monthly premium for it. And then there is Medicare Part B, which covers doctor visits and outpatient care. In 2026, the standard Part B monthly premium is $202.90 per month. I know that sounds like a lot, but here is where it gets really interesting and where I think most people are completely in the dark. There are programs specifically designed to help low-income seniors pay those Medicare premiums, and these programs are available to green card holders. These are called Medicare Savings Programs. Depending on your income, a Medicare Savings Program can actually pay your Part B premium for you every single month. Some levels of the Medicare Savings Program go even further and cover your Part A premiums, your deductibles, and your copayments. In 2026, if you qualify for the highest tier of the Medicare Savings Program, you will also automatically get extra help for your prescription drugs, which means you pay no more than $12.65 for each medication covered by your Medicare drug plan. For someone on a fixed income taking multiple medications every month, that can be hundreds of dollars in savings each and every month. These programs are administered through your state, and your state's Medicaid office is where you apply. Please look this up. Please go to Medicare.gov or call 1-800-MEDICARE and ask specifically about Medicare savings programs. This is not a complicated process, and it can make an absolutely enormous difference. Benefit number 3, SSI, Supplemental Security Income for Seniors, and what nobody told you about the rules. Now this one has the most nuance to it, so I want to walk through it carefully. SSI is Supplemental Security Income, and it is a program that provides monthly cash payments to seniors 65 and older, as well as to people who are blind or disabled, who have limited income and limited resources. It is a needs-based program, which means it is not based on your work history, it is based on your current financial situation. And I know that immediately some of you are thinking, I heard immigrants cannot get SSI. And I want to address that directly right now. The rules around SSI for green card holders are specific, and I want to be honest that they are more restrictive than the rules for Social Security retirement. But they are absolutely not impossible to meet. As a lawful permanent resident, you can qualify for SSI if you are 65 years of age or older, have limited income and limited resources, have been a lawful permanent resident for at least 5 years, and have accumulated at least 40 qualifying work quarters in the United States. Those work quarters can also come from a spouse's work record or even a parent's work record in some cases. That is something a lot of people do not know. You do not have to have worked those 10 years yourself. If your spouse worked and paid into Social Security for 10 or more years, that may count toward your eligibility for SSI. And importantly, SSDI, which is Social Security Disability Insurance, is a completely separate program with different rules. Green card holders who have enough work credits and who have a qualifying disability can receive SSDI, and the average SSDI payment in 2026 is approximately $1,580 per month. Now, I also want to tell you about something that exists at the state level. Some states have created their own supplemental programs specifically for immigrant seniors who do not yet meet the federal SSI requirements. California's program is called CAPI, the Cash Assistance Program for Immigrants. If you are in California and you are not yet eligible for federal SSI, this program may be able to help you. Several other states have similar programs. So even if you think you do not qualify at the federal level, please call your state's social services office and ask specifically about state-funded assistance programs for immigrant seniors. Benefit number 4. SNAP food benefits. Yes, green card holders are still eligible, but you need to know these updated rules. I have to talk about food assistance today because this is where I am seeing the most confusion and honestly, the most heartbreak. People who desperately need help with groceries, seniors living on tiny, fixed incomes with rising food costs, and they are not applying for SNAP because they are afraid or because they genuinely believe they are not eligible anymore. So, let me be very clear about where things stand right now in July 2026. Green card holders, lawful permanent residents, remain eligible for SNAP benefits under federal law. The One Big Beautiful Bill Act that became law last year made major changes to SNAP eligibility for other immigrant groups, but it did not eliminate green card holder eligibility. What it did do is tighten things up in a way that has caused enormous confusion. The 5-year waiting period still applies to most green card holders, meaning you generally need to have been a lawful permanent resident for 5 years before you can access federal SNAP. However, there are exemptions to that 5-year waiting period. Children under 18 and people who are receiving disability benefits are exempt from the 5-year bar. And if you entered the United States as a refugee and later became a green card holder, you are also generally exempt from the 5-year waiting period and should be eligible for SNAP right now. Here is something really specific to seniors that I want to make sure you know. Once you hit the age of 60, SNAP actually has special rules that work in your favor. Income limits for SNAP are calculated differently for seniors. If you are 60 or older, your household's income is measured based on net income rather than gross income, which means allowable deductions are taken out first before they check whether you meet the limit. And one of those deductions is a medical expense deduction. If you are 60 or older and you have out-of-pocket medical expenses that exceed $35 per month, the amount above that $35 can actually be deducted from your income when determining your SNAP eligibility. So if you are spending $300 a month on medications and doctor copays, $265 of that is coming off your income calculation. That is significant, and it means a lot of seniors who think they are over the income limit may actually qualify once those deductions are applied. The fact that only about 16% of eligible seniors take advantage of that medical expense deduction is honestly something that keeps me up at night, because those are real people leaving real food assistance on the table every single month. Please do not be one of those people. And lastly on SNAP, I have to give you a heads up about something important. Some states right now are incorrectly applying the new OBBBA restrictions and are turning away people who are actually eligible. Specifically, some states are mistakenly applying the 5-year bar to refugees who became green card holders, which is wrong under federal law. If you have been told you do not qualify for SNAP and you believe you should, You have the right to request a fair hearing. Ask for it in writing. Do not just walk away. You have rights. Benefit number 5. The spousal and survivor benefits. Most immigrant families have never heard of. This is the one that genuinely floors people when I talk about it, and I think it might be the single most overlooked benefit for immigrant seniors in this country. So I want to make sure you are listening carefully to this one. If you are a green card holding senior and you did not personally work enough years in the United States to qualify for Social Security benefits on your own record, you may still be able to collect benefits based on your spouse's work record. Social Security spousal benefits can be worth up to 50% of your spouse's full retirement benefit. And if your spouse has passed away, Social Security survivor benefits can be worth up to 100% of what your spouse was receiving. These benefits are available to lawful permanent residents. Your immigration status alone does not disqualify you from claiming on your spouse's record. This also applies to Medicare. If you did not personally work the 40 quarters needed for premium-free Medicare Part A, but your spouse did, you can qualify for premium-free Part A based on your spouse's work history. And survivor benefits extend here too. If your spouse passed away and had enough work credits, you can qualify for premium-free Medicare Part A as their surviving spouse, even if you did not personally work those years yourself. I think about how many widows and widowers are out there right now. Immigrant seniors who lost their spouse, who are struggling, and who have no idea that their spouse's work record is still providing them access to these benefits. Please share this video with someone who needs to hear this. Please share it with your neighbor, your sister, your friend from your community who is struggling. This information can change someone's life. And here is one more thing I want to add under this benefit because I feel like it is so important. If you worked in your home country before coming to the United States, there is a possibility that your home country has what is called a totalization agreement with the United States. These are bilateral Social Security agreements between the U.S. and more than 30 countries. Under these agreements, work credits you earned in your home country may be combined with credits you earned here in the United States to help you meet the eligibility threshold for Social Security benefits. Countries that have totalization agreements with the U.S. include Canada, Mexico, the United Kingdom, South Korea, Japan, Germany, Italy, France, and many more. If you are not sure whether your home country has a totalization agreement with the United States, go to ssa.gov and search totalization agreements. This could mean the difference between qualifying and not qualifying for benefits you genuinely deserve. So let me bring this home because I want to make sure you are leaving this video with a clear picture of everything we covered today. We talked about 5 things. Your Social Security retirement benefits that are sitting on your record waiting for you, Medicare coverage that green card holders are fully eligible for, along with the Medicare savings programs that can dramatically reduce what you pay, SSI and SSDI for seniors and disabled green card holders who meet the eligibility requirements, SNAP food benefits, and the special rules that actually favor seniors 60 and older, and spousal and survivor benefits as well as totalization agreements that open doors for people who did not work full careers in the United States. I know there is a lot of fear in immigrant communities right now. I know the news has been frightening. I know there has been an enormous amount of change, and that change has created an enormous amount of confusion. But I need you to hear me when I say this. Fear is not a benefit strategy. Fear will not put food on your table. Fear will not pay your doctor's bills. What will help you is accurate information and the courage to take action based on that information. And that is exactly what I am here to provide. I show up for this community every single day because I believe you deserve an advocate. I believe that if you worked for this country, if you paid into the system, if you made your life here, then you deserve to benefit from the programs you helped build and fund. Nobody is going to knock on your door and tell you what you are owed. You have to know it yourself. And now you do. If this video helped you or someone you love, please share it. Hit that like button if you are watching on YouTube because it genuinely helps me get this information in front of more people who need it, and drop a comment below and tell me which of these 5 benefits surprised you the most. I read every single comment and I truly love hearing from you. I will be back again very soon with more updates. You are not in this alone. I mean that from the bottom of my heart. Take care of yourselves, take care of your families, and I will see you in the next one.